Hey, what's up guys? It's your girl Kay and I am back with a new update video for you guys. I know it's been a couple of weeks since I made a video and I do apologize, but you know how school goes. I've been super busy studying and doing things and working and stuff like that. I'm making a lot of changes in my life in terms of how much I'm working and where I'm working and things like that, and so I'm trying to kind of get into the groove of like switching things around, but I'm back. If you guys haven't watched my old videos, my name's Kay. I'm 29 years old. I'm from Boston, Massachusetts, and I am in a 2-year nursing degree program at a local community college. I'm in my second year right now, third semester. This semester we're learning about pediatrics and maternity. Last semester we did med-surg and psych. The semester before that was a general introduction to nursing, learning all the basics and things like that, learning vitals and everything. So I'm really getting well acclimated to nursing school, even though it's just about to be over. And I've been trying to stay afloat with everything that's been going on in my life. Craziness. Please don't mind my hair. It's wild right now, and hence the reason I'm wearing a hat. But I think it looks cute, so whatever. So this semester, maternity and pediatrics. I am doing maternity for my first clinical rotation. We're getting ready to switch actually in about 2 weeks, and I'm going to be doing pediatrics, but maternity has been awesome. We missed a lot of days of clinical just because of the snow. In case you guys didn't know about the blizzard of Boston, Stormageddon 2015, it's been crazy. We've gotten over 100 inches of snow in Massachusetts, and so we've been fighting to go to school because we've been missing a lot of days, and so now we have to make up all the days we missed, which is gonna suck, but whatever. So I haven't really had a lot of time to be on the maternity ward at the hospital that I work at. I have clinical once a week now instead of twice a week, so I am there for 12 hours once a week, but because we miss so many days, I don't really get to be there a lot. In maternity, I've had a lot of good experiences. I haven't actually gotten to watch any deliveries, which kind of sucks, but I have been working with a lot of moms postpartum, and that's always awesome to, you know, hear them talk about their experiences. I had a patient that I really connected with, and she told me her whole entire like labor and delivery story, and it was a crazy story. And you know, the nurses were like, you know, that's really great that you're talking to her. You're a really good student. That's what you should do, is talk to your patients, get to know them, make them feel comfortable. And so I'm really happy that, you know, I could be recognized as a good student and recognized as being really helpful. We do a lot of assessments there. We do assessments on the moms, we do assessments on the newborns, and you know, you learn how to do assessments on patients, and it's different for newborns, so we had to kind of adjust to doing that. Checking the lochia, aka the bleeding from when a mom delivers a baby, either through cesarean or vaginally, you still bleed afterwards, and so we have to check that, check the consistency, how much it is, if there's a smell to it, things like that, and that's definitely different. I actually got to experience my first case of hemorrhoids this past clinical session, and that was really different to look at because I've never seen hemorrhoids before, but you know, I looked and I saw, and I got to, you know, work with the breasts and the milk ducts and things like that, and touch the uterus and assess the fundus, and my nurses were really cool and they were really helpful, and so I'm really grateful for the experience to be able to be in the maternity ward and learning all these things about delivering. A lot of things scare the crap out of me and makes me not want to have kids, but when I see the newborns and I get to touch them and play with them and, you know, assess them and things like that, I'm like, oh, I want a baby so bad. But it's been a lot of fun. So I'm looking forward to pediatrics. I'm looking forward to working with the kids. I think it's going to be a really cool experience. Thus far, we've learned about a ton of things. When it comes to maternity, we've learned about pregnancy, antepartum, so before you know, you give birth. We learned about labor and delivery. We learned about postpartum. We learned about newborn care. We've learned about nutrition in childcare, or in terms of like feeding newborns. In pediatrics, we've learned about sickle cell anemia in kids. We've learned about cardiovascular, respiratory illnesses. We've learned about growth and development. So that's been pretty cool to, you know, learn a lot of stuff, because I feel like it relates more to our everyday lives, and in terms of like what we experience, people having babies and dealing with kids, nieces, nephews, grandkids, kids, whatever. We get to learn a lot more about stuff that we live every day, as opposed to learning about psych, where you're not in the psychology world all the time, you know? And so I think that that's really awesome. So I'm having a lot of fun this semester. If you guys don't remember my last semester, I just barely passed by like the skin of my teeth. I got a 78.3 in my final grade, and a 78 is passing. And I'm looking at like my disgusting room right now, and you guys know my room's always dirty, so you might as well just chalk it up to me being me. I never clean my room. Sorry. So I just passed by the skin of my teeth, and I was really afraid that this semester I wasn't going to do too well. And it turns out that we've had 2 exams so far, and I've passed both of them above my normal expectations. Usually I get within the 70s, high 70s, low 70s. I've gotten 80s, in the 80s on both my exams, which is really great for me because it kind of helps with my overall grade. The better you do on your test throughout the semester, the lower grade you need to get on your final to pass the class. So I'm hoping that by the end of the semester, I probably need like a 40 or a 50 on my final to pass, which I know I can achieve, and then I'll be all set to go. I'm really excited. The end's getting closer. We're getting near graduation. I am trying to, do new things. I'm actually going for my CNA certification now because I've decided that I want to actually work in the field that I am going to school for. And because I am in nursing school, I can actually bypass taking the CNA course and just go straight to taking the state exam. And I've done practice exams online and everything like that, and I've passed with like flying colors, so I'm not too worried about passing the exam. And I figure that once I get my CNA certification, I can find a job somewhere and I can work in the hospital and get that nursing experience, and then hopefully when I graduate from this program I can get a job at the hospital I'm working at, or a hospital nearby because I have experience and they know me. Out in Massachusetts, 2-year degrees, associate's degrees, nurses who have associate's degrees don't generally get hired. They're looking more for bachelor's degrees, so it's kind of hard to find a job as an associate's degree RN. But I'm hoping that being a CNA will get my foot in the door so that I can actually get a nursing job when I graduate this program. But if not, I continue to be a CNA, and I might just get more money because I am licensed. So that'll be cool. That's pretty much all I've been doing, guys, just studying and doing homework and writing papers and doing projects and stressing about life, going through things. I'm sorry you guys can hear my mom in the background because she's super loud when she's on the phone, even though she's like 4 rooms away from me right now. She yells. You know how parents are. They yell when they're on the phone because they can't hear, apparently. So I apologize in advance for that. But I just want to say what's up to you guys. I just want to let you guys know that I'm still alive. I'm still here. I'm doing great this semester. I own this semester. Maternity and pediatrics. Woo woo! I own it. So I'm very excited about the progress that I'm making. I am so excited to be progressing in this program and making moves and learning a whole bunch of new stuff. And when people ask me things that have to do with like medical terms and I know them, I get super excited. So if you guys are having a tough time in nursing school, stick with it. You guys will do great. If you guys are just starting out in nursing school, leave me some comments. Let me know how you're doing. Let me know what you're worried about. If you're scared, I can't really give you like lectures and lessons on topics because I don't retain too much information, but I will let you guys know what's been going on and how I dealt with a lot of things, because nursing school is hard. It's not as easy as you think. So I'm not going to keep you guys too long. It's already been 9 minutes. I know you're tired of seeing my face, and I will catch you guys on the flip side. Actually, probably soon. I'll make another video for you guys after whenever, so you guys know what's going on. But I'll catch you guys later. Have a good night, have a good day, have a good year, study hard, sleep, drink water.